Today I was dispatched to a 20-year-old patient. Chief complaint was difficulties breathing. So before I get to the scene, I'll put my BSI on, which is my gloves. And so first I'm going to do the scene size up. I'm going to make sure the scene is safe. The scene is safe. Next I'm going to do the nature of the illness. I can tell that the patient is in the tripod position. So I can tell he's having difficulties breathing. I'm going to determine the number of patients, which I only see one. I'm going to assess the need for additional help. I don't need any additional help at this time. I'm going to take C-spine precautions, but I don't see a need for C-spine precautions. I'm going to start my initial assessment. The general impression of the patient is that he is in mild distress. He's having difficulties breathing. I can tell because he is in the tripod position. I'm going to state my name to determine his level of consciousness and responsiveness. So, hi, I'm EMT Camaro. What's your name?
Tyler.
Okay, so I can tell that he is breathing. Any apparent life threats would be that he is having difficulties breathing. So I can tell he does have a patent airway because he is talking to me. But at this time I'd put a non-rebreather on him at 10 liters to make sure he has adequate ventilation. I'm going to assess his circulation by his radial pulse because he is conscious. He does have a good radial pulse. I'm going to control any bleeding, but there is no bleeding going on. I'm going to assess the skin signs. He looks normal. There's no cyanosis around his mouth or anywhere else. I'm going to determine that right now the patient is low priority, but we do need to transport quickly. And I'm going to determine that we're going to do a focused history and physical exam. So I'm going to start with the sample history. So I'm going to ask him what he's feeling. So what are you feeling, sir?
Hard to breathe.
You're having a hard time breathing? So when to start?
Earlier today.
Okay. Does sitting like that make you breathe better?
Yeah.
Okay. You in any kind of pain? You have pain anywhere?
No, just trouble breathing.
Okay, so since he doesn't have pain anywhere, the rest of my OPQRST is done. The quality, he doesn't have any pain anywhere. It doesn't radiate anywhere. The severity, he doesn't have any. And the time that the pain started, he doesn't have any pain. Okay, so now I'm going to ask if he has any allergies. Sir, do you have any allergies?
No.
Okay. Do you take any kind of medication?
No, sir.
You don't take? Okay. What kind of medical history do you have?
Asthma.
You do have asthma?
Yes, sir.
Okay, when was the last time you ate?
Earlier today.
What were you doing leading up to this? Were you just sitting here and just had difficulties breathing?
Yes, sir.
Okay. So now I'm going to tell my partner to take vitals, and I'm going to give him albuterol at this time to help him breathe. I'm going to give it right through his non-rebreather mask. I'll probably put it up to 15 liters now, and now we are going to get him into the ambulance. So go ahead and lay down. Okay, so I'm going to do the physical exam now. He is in the ambulance. So I'm going to look at his head for any kind of symmetry and any kind of scars that's going on. He doesn't have any scars or anything in his head. I'm going to look at his neck. I'm going to palpate it. He doesn't have any JVD or tracheal deviation. I'm going to look at his chest, make sure it's equal chest rise and fall. Any kind of chest flail or anything going on. I'm going to palpate his abdomen for any kind of abdominal distension or any kind of rebound tenderness. I'm going to palpate his pelvis to make sure that his pelvis is stable. I'm gonna go down here to make sure he has distal circulation in his feet, which he does. I'm gonna have him press on my hand for me. And can you wiggle both feet for me? Okay. Can you close your eyes and tell me what foot I'm pressing?
Right.
Okay. So now I'm going to go up here to his arms, and I'm going to check for circulation in both arms, which he does have circulation. I'm going to have him squeeze my fingers. Okay, can you close your eyes? Tell me what I'm pressing.
Right.
Okay. So, everything looks good on the transport. I will keep doing an ongoing assessment. At this time, I'll take another set of vitals and compare it to my first set, and wait until we get to the hospital.